Hey guys! Every year you notice that my Facebook page is flooded with cystic fibrosis awareness and I practically beg for donations. Cystic fibrosis is a genetic disorder that causes the body to produce abnormally thick and sticky mucus in the lungs and digestive system. So people with cystic fibrosis have a really hard time breathing. They often are sick because they have bacterial or viral infections in their lungs. Their body can't absorb nutrition. They can't digest food, so they're often malnourished and underweight, and they don't grow as tall as they should. So this causes a lot of problems. People with cystic fibrosis take a handful of medications. On average, about 40 to 60 digestive enzymes are taken a day. Anytime someone with cystic fibrosis eats, they have to take these enzymes, usually about 6 for a meal and maybe 3 or 4 for a snack. Cystic fibrosis has no cure. So that is why I advocate every year, because there are advancements in medical treatments that are allowing people with cystic fibrosis to have close to normal lung capacities, as well as a better quality of life, and they're living longer, and even some CF patients are having children, and that's just really incredible. That was unheard of just a decade ago. So 2 of these treatments that have been done by the Cystic Fibrosis Foundation's research is Kalydeco and Orkambi. Both of these address the underlying genetic issue that causes cystic fibrosis, and it's not a cure, but it helps immensely. So now what they're working on doing is getting this kind of treatment for every genetic mutation of cystic fibrosis. There are several, so it's going to take a while, but I don't want to stop until everyone with CF can receive this kind of treatment, and I really don't want to stop until we can find a cure. So every year I just kind of post a brief story about my connection with CF, so I thought this year it'd be more detailed and get more personal with it. So here we go. My cousin was born on August 9th with cystic fibrosis. He was diagnosed shortly after birth and had to have surgery on his intestines because they were kinked and it was causing a blockage. And he wasn't really expected to survive that, but he did because he's such a trooper. So here's Josh at 3 weeks old. And something you'll notice is that people with cystic fibrosis are extremely pale. They're very small. Here's him at 11 weeks. I believe they got to take him home at this point from the hospital. So yeah, here's a really good example. He's got the tiny little legs and the big diaper, and I mean that's just for 3 months old, and it looks like super huge on him. This is Josh at 3 years old, and he still managed to grow up and kind of have a little bit of a normal childhood. Here is my grandfather doing therapy on Josh. So people with cystic fibrosis, for a long time, their parents or caregivers would have to sit the child on their lap and just like beat on their back, and what that would do was loosen up the mucus in their lungs so they could cough it up and get it out of their lungs. Now, thanks to the University of Minnesota, there's a vest that can be purchased, which is very expensive, but the patient puts it on and it vibrates on their chest and it breaks up the mucus and they can cough it up. People with cystic fibrosis do several treatments. They have anywhere from 3 to 4 or 5 nebulizer treatments. Personally, Josh did albuterol, which is for bronchial asthma. He did a hypertonic saline nebulizer, which would help thin out the mucus in his lungs so he could cough it up easier. He also did Ventolin, which does the same thing, breaks it up, helps it to be coughed up easier. And he also did Colicin, which is an inhaled antibiotic for bacterial infections. And he also had to do vitamin K and A shots because his body couldn't naturally absorb that via food or pills, so it had to be through injection. And even then, his body really didn't absorb a lot of it, so it was just kind of like whatever we could get in him would be good enough. He also did the Zinpep DR 20,000 units. Those are his pancreatic enzymes to help break down and enable absorption of nutrition. And he did Ursidil, that was for elevated liver enzymes. Also Prevacid for esophageal ulcers caused by the pancreatic enzymes. And whenever he would get a bacterial infection, which was very often, he would have to do IV antibiotics such as Zosyn, vancomycin, tobramycin, and azithromycin. And every other month he would do Pulmozyme, which was another inhaled antibiotic for bacterial infections. A lot of times people with CF will do that so that they can kind of prevent the bacterial infection from occurring. People with really bad cystic fibrosis often are on oxygen, anywhere from 3 or more units really. Some will have a BiPAP machine that will help them to breathe easier, so it's not such a chore or a task on them. So that was kind of an everyday thing for Josh. A lot of medications. Here he is growing up, and they always told us, you know, like, he's not going to make it through elementary school, he's not going to make it through middle school or college, but every time he just seemed to beat it. So here's Josh at his first job at Sonic in high school, and he graduated in 2002 and got to go to his graduation, which was really cool. Then he later went to Kaiser University and studied culinary arts, and his dream was to become a chef and to manage his own restaurant. So he became a chef and graduated from Kaiser with his friends, and he worked a job at Bonefish Grill for a while until the doctor told them that if he did not quit, it would kill him. So here in this point, in 2007, he was probably the most healthy at that point. Here's him and my uncle. They were really close. Shortly later, he had a really bad digestive blockage, and the doctor thought it was appendicitis, so they removed his appendix. And like, that surgery was really risky, one because it increased his risk of contracting different bacterial infections, but also because he was so thin and frail, the surgery could have been too stressful for the body and he could have died. He made it through the surgery, but he did contract MRSA in his lungs, which is just kind of putting a death sentence on you, really. So things really went downhill after that. We went from doctor's visits every year, or a couple times a year, to almost every month. A lot of times just calling in, you know, antibiotics to be done via IV and stuff like that. This was the last vacation he went on with us. We were down in Orlando. He didn't really feel good, but he still wanted to cook us this Mediterranean dish. This kind of just shows you how little he was, and you can see how pale he was because, like, he just isn't getting enough oxygen. This was Thanksgiving 2011. This is when he was kind of really just going downhill. He was on the double lung transplant list because his right lung was completely full of pus and mucus and infections and stuff like that. But he still remained a very positive attitude. I never ever heard him complain. And you know, he was just really tough. Here's his mom, him, and his brother and sister. And that was also Thanksgiving. And then here's Christmas. And yeah, so he was, really pale, thin, very little, but he hung in there. You can see just how malnourished he was, just how sick he was. That's him and my uncle, Christmas, 2011. Sadly, we lost Josh to cystic fibrosis on April 30th. He lost his battle when his lung burst, and all of the mucus and infection was so potent it took his life in less than a minute. This was 3 days prior to him passing away. 2 days before he passed away in 2012, they had the Great Strides Walk, which helps to raise funds and awareness for cystic fibrosis, and we had team shirts, and he was always just very positive and uplifting, and these are the last pictures that we have of him and with him. And the reason that I'm so adamant about raising funds and awareness for cystic fibrosis is because the hardest thing to do is plan a funeral for someone who should have lived a way longer life. It's very hard. You're going through, okay, what did this person want? What pictures are we gonna put in the bulletin? What pictures are we gonna show at the viewing? One of the hardest things I've ever had to do in my life, and I've been through a lot, was to stand up before 300 or 400 people whose lives he just impacted just by being him, and tell them how great Josh was and how much I'm going to miss him and how much I love him. I hope that one day that we won't have to be raising awareness that there will be a cure, and that's why I just advocate. I want so badly for people with CF to have relief, to have a cure, and I don't want any other families to have to plan a funeral or attend a funeral for someone with cystic fibrosis. And just because Josh's battle ended, that doesn't mean mine has. I won't stop until more treatments are produced and a cure is found. And something that was really cool is people that worked with Josh at Bonefish Grill, they showed up to his funeral dressed in their culinary uniforms, and I just want to shout out to them because Josh needed to work 25 hours a week, and when he couldn't cook, they had him be a waiter. When he couldn't lift the trays anymore, they had him just come in and roll silverware and things like that. So thank you guys. You guys are so awesome. But we would love to have you come out to the Great Strides Walk on April 30th. Check-in begins at 8 a.m. It's at McClay Gardens, and we would love to see you there, and we'd love for you to go and check out Cystic Fibrosis Foundation's website because it gives more information about cystic fibrosis. It also talks about the research that they're doing and treatments that are down the pipeline to be released, and it'll give you a more detailed idea of what cystic fibrosis is, how people living with that handle that, and various treatment options. And I just really encourage you, if you can, just even $5, make a donation, because out of every $1.90 of it is going to research, is going to care centers that put every doctor under one roof that people with cystic fibrosis need to see. There's 19 care centers in the country, and there needs to be more. The foundation does not receive any government aid. It is completely ran off of donations and people giving as they can to the foundation. And something that's really great about this foundation is they help people who can't afford care financially to get the care they need. So I really just encourage you to check it out. Come join us at the walk, and hope to see you there. Thanks, guys.